So I'll assume that you've read the passage already. It can be inferred from the passage that a doctor who wishes to detect the presence of a bile duct stricture within a patient would have the most success by performing which of these procedures? A. Having the patient fill out a questionnaire about the patient's diet and habits over the past 10 years. Well, this wouldn't tell them anything because even though diet and habits can certainly lead to them, the fact that they can be anywhere and may not have symptoms, this wouldn't help. B. Allowing the patient to undergo certain surgical techniques but without the use of anesthetic. Well, that would make the patient really unhappy, but that's definitely wouldn't give help in detecting bile duct strictures. C. Pinpointing certain areas of the duct system based on the patient's history of surgery and then conducting ultrasound scans. The passage does say that things like non-invasive things like MRIs and ultrasound can help detect bile duct strictures, but only if you sort of know where to look. But there's this other theory that history of surgery may tell you where you should look. So choice C is pretty tempting. D, considering the patient's entire medical history with a focus on the types of medications the patient has taken. Again, since medications, all they do is really mask it, it wouldn't make, type of medication doesn't affect what the, where the bile duct strictures take place. E, examining the patient's urine and saliva and taking samples from the patient's pores. This would be true in the old days, but the prevalent use of multivitamins and antibiotics keep these symptoms hidden. So choice E is not it. Choice C is clearly the new way to go.